and we will get started. We will put this program on our YouTube channel and on our website for anyone that needs to listen in. First, I'd like to just tell you a little bit about our Elder Safe Center. Elder Safe was established in 2014 as a comprehensive healthcare-based elder abuse prevention center, serving physical, sexual, financial, and psychological abused and neglected older adults from Maryland, Washington, D.C., and Northern Virginia. Elder Safe provides safe temporary shelter, medical, therapeutic, and counseling services in our award-winning Charles E. Smith Life Communities, long-term care, and independent living residences. Elder Safe also provides free elder abuse trainings and advocates to improve systems and laws to protect older adults from abuse and neglect. The program is managed by Keita Cross, and Keita, I'm going to ask you to give a little wave. Keita's joining us today. Keita has laryngitis. That's why I am doing this introduction. Keita has over 20 years experience with elder services and social services, including assistant district public guardian for area agency on aging. Gloria Key, who I believe is also here today. Gloria, if you can give a little wave. Gloria is the client services manager, who also is a very accomplished licensed social worker. An award-winning program at Charles E. Smith Life Communities, Elder Safe works in close collaboration with community partners to build a strong and effective response to elder abuse across our region. Now it's my pleasure to introduce our speaker today. Rafael Espinoza is the director of the State Health Insurance Assistance Program, SHIP for short. And he has served in the healthcare industry for 30 years. He specializes in Medicare and Medicaid, working in both the private and public sectors. Rafael, thank you for joining us today. I will let you take it away.
Thank you, Robin. Can you hear me clearly?
Yes, you sound great.
All right, thanks. Welcome, everybody. This is Rafael, director of the Montgomery County SHIP program. Today, we're going to talk about the coming up Medicare open enrollment, as you see on your screen. And this Medicare open enrollment is for Part D and Part C. Okay, all right. Just a refresh about Medicare. You may be in one of these options. Option one is when you use your Medicare, your original Medicare. You are enrolled in Part A, you are enrolled in Part B, and you have your prescription drug Part D plan. Additional to that, you also have your Medigap or Medicare supplement. If you are in this option one, definitely the open enrollment is for you. Now in option two, you are in a Medicare Advantage or Part C. Medicare Advantages are private health insurances contracted with Medicare to provide you health coverage. These Medicare Advantages provide you the same coverage as original Medicare, Part A, Part B. Many of them give you prescription drugs or Part D. And the most important part of these plans are that they give you additional benefits that Medicare doesn't cover, like vision, dental, and hearing. Now, the Medicare Advantage open enrollment happens during the month of January and March of every year. But during this current coming up open enrollment, what you can do is if you are in the original Medicare, you actually can switch to Medicare Advantage for the following year. That's what you can do during this open enrollment. Also, if you have already Medicare Advantage, additional to the regular Medicare Advantage open enrollment that I mentioned that happens during January and March, additional to that, during this open enrollment, you can also switch your Medicare Advantage plans if you wish for the coming year. So for Medicare Advantage, basically you have two opportunities of switching. Now, during this open enrollment period, you can switch your prescription drugs or Part D, or your Medicare Advantage plans, your Part C, as I mentioned before. This open enrollment period happens during October 15 through December 7 of every year. And this is the only time that you can change your Part D plans. Remember, you have an additional opportunity with Medicare Advantage during January to March of next year. Now, if you make your switch in this open enrollment period, your changes will take into effect on January 1st of 2023. Now, what you need to do before the open enrollment starts, you need to review your current health and drug plans because plans can change their offerings every year. Your health or finances may have changed as well. So those are situations that happens, unfortunately, every year. Even if you are happy with your current plan, either Medicare Advantage or prescription drug plan, you may save money or get extra benefits or both if you decided to switch. You don't have to if you are happy, but if you switch, you may save some money or get these extra benefits. Take advantage of the coming up 2023 plan premiums because they are very, very low. Hundreds of plans offer now insulin for only $35 a month. So it's very important for you, for those who are taking insulin, if if you switch to a plan that offer this insulin for $35, it will be of great benefit for you. Now you can do this comparison if you wanted to know what plans are available for you, more cost effective. For next year, you can do this yourself. You can do the plan comparison through your Medicare.gov website, and you just need to go to the health plan finder and use that tool in order to identify 2023 new plans that are more suitable for you. You can do that again by going to Medicare.gov and use the health plan finder tool. You have to put in there, additional to your information, you need to put there all the medications that you are taking. Only prescribed medications, okay? You don't need to put over the counter because those are not covered by your prescription drugs. Only prescribed ones. And then once you do that, the system automatically will provide you, start with the cheapest plan all the way down to the more expensive. Also, you can do is to contact us, Montgomery County SHIP, and we can help you find these prescription drug plans available for you to next year. You can go to our website and you can either complete electronic form in there. We'll get it here and we will do the analysis for you. We will find at least one or two plans that are more cost effective for you for the following year. Now, we do only prescription drug plans. We don't do Medicare Advantage plan. And the main reason is because prescription drug plans, the demand for these analysis are greater than Medicare Advantage. And additional to that, Medicare Advantage plans are only few, easy to identify. You can do that either by going to Medicare.gov or by reviewing your 2023 Medicare and You book that you probably already got it. If you have it, in the end of that book, you can see the Medicare Advantage plans available to you here in Montgomery County. There are only few, there are not that many, so they will be, again, easy to identify. So you want us to help you, we will be more than happy to do that, but we will do only the prescription drug, the Part D plans for you. Again, you can go to our website, which is www.medicareabcd.org. You can complete an electronic form in there, and we will find you the most cost-effective plan for you for next year. Now, there are some special enrollments that may apply to you. If you change where you live, for instance, if you move from a state to another state, from Maryland to Florida, for instance, you have to switch your prescription drug and your Medicare Advantage plan. But if you move with the same state, if you have prescription drugs, you may not need to change your prescription drugs, but you may change your Medicare Advantage if you have a Medicare Advantage plan. Unfortunately, Medicare Advantages are county. Each county have their own Medicare Advantage plan. So if you move from one county to another county, you have to switch. You have to look and see if the plan that you currently have in Montgomery County is also suitable for the county that you are moving in. So it's very important for you to review the Medicare Advantage plan in your new residence area. Prescription drugs, those are statewide, so you don't need to do that with prescription drug plans. But if you move outside the state, yes, you have to, okay? It's very important. Now, if you lose your current coverage, some people are enrolled in Medicare Part A, they delay the enrollment in Part B, then suddenly the reason why they do that is because they have employer health benefit coverage. And when they lose that coverage, they have the right to enroll in Medicare Part B, and they have the right to pick their prescription drug coverage. Okay, so that's if you lose your current coverage. Sometimes, right now, for instance, if you find a prescription drug plan or a Medicare Advantage that are favorable to you, you can take this opportunity also to switch or to look into it and see if, by asking the right questions, if these plans available to you are good or not for you. Now, with the plans that you currently have, change their contract or they actually no longer want to work with Medicare, that's another opportunity that you will have to switch to another plan. And some other special situations may apply also for you to be able to switch. Every time a special enrollment applies to you, it's a limited time to do the changes. So usually it takes in between 30 to 60 days. So that's the frame time that you have to make sure that you make your changes. You can call us. You can call us here at 301-255-4250, 301-255-4250, or you can contact Medicare at 1-800-Medicare, 1-800-Medicare. Now, I always talk about fraud and abuse because it's very important for everybody to be aware of what's going on in regards to these items. Unfortunately, Medicare lose millions of dollars because of fraud and abuse. And you are our first line of defense against this. And then you have to review your Medicare summary notices in order to identify that every services that you have received actually is there, and not some other services that you probably have never used it, and somebody's trying to trick Medicare in order to pay out services that you have not received. Also, make sure that every time that you receive a medical services, I'm just going to give you an example of abuse. If you are having a physical therapy and you are prescribed 5 sessions of it, and then you go through your 5 sessions and you feel very fine, now you're okay, but maybe the physical therapist or the physician maybe order another 5 sessions that you may consider unnecessary. So if that is the case, you can report it to Medicare and Medicare will take care of it. you don't have to go to sessions that your provider prescribe for you once you complete your first 5 sessions. I just giving you that as an example for you to try to understand what abuse means, but this is important.
Hold on one second. Let me just.
Review your Medicare summary notices. If you have not created a Medicare account, then you will get your Medicare summary notices every 3 months. But if you have created a Medicare account, you can review your Medicare
Okay.
summary notices every month. It's updated monthly. So those are the ways you can review these Medicare summary notices. Now, you can do this again. You can do the comparison plan yourself. You go to Medicare.gov and use the health plan finder, or you can contact us and and we may be able to help you in finding a more suitable plan for you for next year. Now you have in your screen our website where you can go and complete the electronic form, or you can call us and request a form to be mailed to you, or you can email us to ship@accessjca.org, and we can email you a form to you so you can complete it, and you can either email it back or mail it a regular mail. I will not recommend to email it with your information on it because it's not secure. So, but if you don't mind, you can email it, but I will not recommend that. If you get the paper form either by email or by mail, just return it to us by mail. That would be a best way to get it to us, okay, and secure way. So contact us if you need assistance with these plan comparisons. Now, again, we do only prescription drug plans. We don't do Medicare Advantages, okay? Well, now we have questions and answers. Robin?
Thank you, Rafael. That was a wonderful presentation. We have quite a few questions in here. I'm going to start from the beginning. Okay. SB asked, I have good comprehensive federal employee medical insurance coverage, which includes dental, vision, and excellent medication pharmacy benefits. Why would I need any Medicare Part B or Part C?
You don't. You're just saying you have a wonderful federal employee health benefits. If you are happy with what you have, I don't think the reason why you need to get a Medicare Part B or a Part C, which is a Medicare Advantage. If you are part of the federal employee health benefits, actually they also provide you under that federal employee health benefit, they provide you Medicare Advantages. So you can do the Medicare Advantage through the federal government. You don't have to go through Medicare, but it's all based on what you need. If you're happy what you have, you don't have to.
Great, thank you. Next question is asking if you have a listing of providers with a comparison of options.
No, we do not. That's why you need to go to Medicare.gov, place your information there, and then you're going to see the list of providers for you. And you can make actually up to 3. You can pick 3 different plans and you see the comparison of those 3 plans yourself. So, but we use the same tool that you're going to use. We do not have our own, plan finder tool. We use the same one that is in Medicare.gov. So we see the same thing that you will see.
Great, thank you. Another question says, I don't need insulin, but I'm curious as to which plans offer insulin for $35 a month. Do you know that offhand?
No, that's why we need to do the plan finder.
Got it.
Because the plan finder will tell us.
Great. Question, what is Medicare Advantage versus Medicare Part B and Part C? And do you know how much each one costs per month?
Okay, Medicare Advantage is a insurance plan that you enroll with once you are already have your Medicare Part A and Part B. The only way you can join a Medicare Advantage is if you have Part A and Part B. Now, Medicare Advantage is a full insurance coverage. Medicare Part B only covers medical, which means doctor visits, specialty visits, medical equipment, and some rehab, and some other items. But the Medicare Advantage plan is a full insurance coverage, which is also Part C. People don't understand about Part. Sometimes, you hear Part A, Part B, Part C, and Part D, and then you hear Medicare Advantage. Well, Medicare Advantage is actually Part C. Okay. When you use your Medicare as your insurance, you have Part A, you have Part B, and you have Part D. When you use your Medicare Advantage, which is Part C, you just have your Medicare Advantage.
Great, thank you for the clarification. Please make sure you're muted. I'm not sure who that is. Someone asked, can one drop current health care to stay with only Medicare?
I'm sorry, can the noise?
I'm sorry, I'm gonna, hang on one second. I need to see who is, guys, please make sure you're muted. I'm not sure who is not. Got it. Okay.
All right.
I'm sorry, the question was, can you drop a current healthcare plan to stay with only Medicare?
You can, I mean, if you have an employer health benefit, it could be federal, could be state or county, and you also have Medicare Part A and Part B, you can actually drop your employer health benefits. We never recommend to do that because these benefits are very good when they are being provided by the government. But if you are talking about private, a union coverage that you get, and you are not so happy and you have to spend too much money, that's the first thing you need to see. The cost of having Medicare Part A, Part B, and having an employer or retiree benefits through your employer that is kind of expensive. Sometimes it's more expensive than actually Medicare. So you have to do an analysis about cost and what is more brings more benefit to you. From here, unfortunately, I cannot tell you. I don't know what insurance do you have, and and to be able to at least have an idea. But that's something that you need to review. You need to review your health plan. You need to review, besides the cost, you need to review how much coverage give you, and and if that actually is a secondary coverage after Medicare, if that's a good secondary coverage, then you may have to keep it. If you don't, you may need to buy a Medigap or Medicare supplement, which is going to cost you also a monthly premium.
Got it. Thank you. Next question. Leslie asked, is the MDSP DAP still available? Do you advise people on applying for that? And does it roll over year to year, or do you need to reapply?
Now, let me get those letters because you say
MDSP DAP. I'm so sorry. I don't know what that stands for. Leslie, if you want to pop that in the chat, I can clarify.
Can you hear me if I speak?
Yeah, sure.
Okay, it's the Maryland Senior Prescription Drug Assistance Program. I've had clients on it in the past. It was very helpful.
Okay.
But I haven't had to apply anyone in quite a while, so I didn't know if it was even still in existence.
Okay, so they're talking about the Senior Prescription Drug Assistance Program, a speed up. Okay, and the question is?
So I forgot what I wrote in the chat, but I wanted to know if it's still available, if if it rolls over from one year to the next? And
Do you recommend it?
Well, it's a program. Everybody who may consider eligible for, they need to apply for. You apply through the Maryland, the state, through the state website. You just go to the state senior prescription drug assistance program, and you make submit an application there, or you download an application and mail it to them. The benefit is just currently give you up to $50 paying you prescription drug premium. That's the only benefit you're going to get. Unfortunately, they do not subsidize medications. The one that subsidize medication is the low income subsidy or extra help. That is the one who brings the most benefit. They give you up to $30 in paying you prescription drug plan premium, and they subsidize your medication, and you pay for your medication in between $3.90 and $9.80. That's it. It's a very good program, but the income and the asset levels are kind of low, in between. I think for one individual is $1,600, if I'm not mistaken, and 14,000 in assets. If you have less than that, then you may qualify for it, and you apply through the Social Security Administration website.
so I have a comment and a question. The comment for everybody's benefit is, my recollection is that the SPDAP can be in addition to the extra help.
No,
So
you
people
cannot.
can have both.
No, you cannot have both. You have one or the other one.
Well, that's a change then.
Mhm.
And then my question for you is, when people, if we refer people to you, do you tell them about both of these programs? Because if they don't, if they're not eligible for the extra help, they still might be eligible for the SPDAP.
Correct. And keep in mind for the senior prescription drug assistance program, they just count income, no assets count. So if you may, I believe, below 3,500 a month, you may be eligible for it.
And you would tell people about that program if they come to you?
Not only that, we tell them about the other programs as well, because we have QMB, SLMB, which help you with your Medicare cost.
Perfect. Thank you, Rafael. Thank you.
Thanks,
My pleasure.
Leslie. Next question. Who is this? Augusta asks, can you touch on extra help with paying for Part D premiums, especially for those with Medicare only?
Yes, if you apply for it, they will pay up to $30. You already enroll to a prescription drug plan. You can keep that prescription drug plan and apply your extra help to that plan, and they will pay $30 toward your monthly premium. Now, if the plan that you have costs $40, then the $10 difference you have to come up with it. In regards to the medication, all of them get subsidized, as I mentioned it before. So, your plan will cover mainly part of the prescription drug cost, and the extra help or low income subsidy will cover the remaining, and you will pay only $3.90 or $9.80.
Thank you. Sylvia asked, is there a disadvantage to the Advantage plan?
There are some disadvantages. And the first one is that you do not have the freedom to pick any doctors that you want to go. Remember, Medicare allows you to go to any doctor in the US. It doesn't have to be in Maryland. It doesn't have to be in Montgomery County. While you are traveling, visiting relatives or friends, you can go to any doctor in the area where you are. The second benefit is that you don't need a referral. You can pick a specialist anywhere, and you can just call them and find out if they take Medicare patients, and you go in there. If they do, you set up your appointment and you're ready to go. With Medicare Advantage, you cannot do that. because mainly these Medicare Advantage plan are HMO, means you are in network. And when you are outside the network, you cannot see doctors unless it's an emergency and you're in an emergency room, which is different. But regular doctor's visit or especially you cannot do that outside your network. But if you get a PPO, you may be able to do that outside your network. Now you have to come up with some money, you know, probably 30% of the doctor's visit. Maybe you have to come up with it, at least. I don't know. Only depends on in which plan you are with. So that's another difference. The other difference is you cannot see a specialist, any specialist. You have to go through your primary care physician first. And he's the one who's going to decide if you need to see a specialist or not. Many people value that freedom of choose. You know what? Today I want to see a cardiology because I feel like I need it. And you go and see your cardiology if you are a Medicare. But with Medicare Advantage, you have to see your doctor first, and the doctor will examine you and determine if you will need to see a cardiologist or not. So that's are some disadvantages. Now, let me mention now the advantages. Medicare doesn't cover dental, vision, and hearing. If you are original Medicare, you have to pay for those services. If you pick the right Medicare Advantage plan that give you the most of additional services, those are the ones that you need to pick. And those additional services are dental, vision, and hearing, which, like I said before, Medicare doesn't cover. So you can take advantage of those additional benefits. Don't believe it's 100% coverage neither. Okay, you may need to pay some, but it's better to pay less as a Medicare Advantage than pay the full price as a Medicare.
That's a lot to consider there. Thank you.
Mm-hmm.
Latanya asked, does the employer health care end at a certain age?
The employer health. Well, that will be a question for your employer.
Yeah, I think I agree. I think that's something that's employer specific, Latanya, not really a Medicare question.
Mm-hmm.
Okay, we're going to move on. Mary asked, does Medicare pay for nursing home stay? And if so, for how long?
Well, let me make the clarification. Some nursing home has a skilled nursing facility. It's the same. Medicare pays only for, short term. Means if you are moving from the hospital to this facility for, full recuperation after a surgery or after any, a procedure that you have done with the hospital. And it's only for a short period of time. We call it under Medicare, we call it skilled nursing facility, and Medicare will cover. Now, you talking about nursing home long-term care? No, unfortunately, Medicare doesn't cover that. For that, you have to get your own long-term care insurance coverage.
Got it. Thank you. Let's see. Does one need to apply yearly for the low income subsidy, or if one had it last year, does the Social Security Administration automatically reinstate a person?
I think they notify you if you need to do something about your benefit. They send you a letter. I think they pick some different colors of letters, and based on the color, you have to either provide additional information for the coming up renewal, or you have to resubmit a new application. It is a Social Security doing. We don't have much into that because it goes straight to you. We don't have access to that kind of information, but we know that people receive this kind of letters. So all it depends, what letter are you getting?
Got it. And Rafael, can you talk a little bit about when one should start applying for Medicare in terms of age span?
Sure. If you are getting closer to 65, you have 7 months total. Okay, you can apply or enroll in Medicare 3 months prior to your 65-month birthday. You can apply during your 65-month birthday, or you can apply after 3 months after you month birthday. So you have 7 months total to do. If you apply before your birthday, obviously your Medicaid will start the month of your birthday, the first day. If you apply after, it may start the month that you apply. The farther you apply or enroll, the more it's going to take for you Medicare to become active. So if you say apply in the 7 month, probably you Medicare will become active 2 months later. They do that in order to accommodate everybody who's coming and enrolling. You know, they spread the Medicare coverage.
Makes sense. Let's see. Hang on one second. A lot of conversation. Oh, question, and I'm not sure if you can answer this or not, but Barbara asked about where you find long-term care insurance. I'm not sure that's part of a Medicare program, though, correct?
Yes, we don't. We don't recommend insurances. We actually we do not sponsor any insurances. It's against our own rules. The county, which is the one who fund us, the state of Maryland, and the federal government doesn't allow us to sponsor insurances. We
Mhm.
provide you insurances information, but we don't tell you which one is good, which one is bad, or anything like that. We just give you the information. You made that decision. Now, in regards to long-term care, we do not have any information about insurances providing long-term care coverage. Now, what you can do is you can Google it and see the long-term care insurance available to you here in Montgomery County, Maryland. Now, if you are already 65 or plus, buying a long-term care insurance right now, it will be very expensive. Usually we should get this when we are much younger.
Got it. Thank you. I believe we have addressed, oh, wait, sorry. If I have federal health benefits and I'm not retired and don't apply for Medicare within enrollment period, will I get a penalty under Medicare?
No, if you're still working and you're still under your federal employee health benefits and you're still working, you don't have to do anything in regards to Medicare. Now, remember, in November, if I'm not mistaken, the federal employee health benefits also have their own open enrollment. So you may try to see if the current plan that you have is good, and if there are other plans more, financially more better for you for next year. But that will be with the federal government. It doesn't have anything to do with us, with Medicare. If you're still working, don't do anything.
But Rafael, if you don't work for the federal government and you turn 65, are there parts of Medicare that you do need to apply for regardless?
Yes, if you are not working or you are working, well, let me make this clear. Being a federal employee, if you reach 65, you don't need to do anything. If you are in the private industry, also apply the same rule. You have an employer health benefit, that have more than 20 employees, and that group health benefits, you don't have to do anything until you retire or until you lost the insurance. And with the federal government, same thing, same rule. The difference is when federal employees retire, they continue having benefits. In the private industry, when we retire, 99% of them, they don't give us benefit after retirement. That's when our benefit ends. and that's when we take advantage of Medicare. That's the difference.
Got it. And one more question. Charles C., I guess it is, asks, is it possible to switch from Medicare Advantage back to the original Medicare during open enrollment season?
No, to drop your Medicare Advantage, you have to do it during the Medicare Advantage open enrollment, which I mentioned in the beginning is from January to March of every year. So you have to wait until January to drop your Medicare Advantage and go back to original Medicare.
Got it. Great. Are there any questions that we didn't address? I've been reviewing the chat and I think we've covered, there was some great conversation back and forth between you all about some of the questions that were asked. And that was very interesting to see. I do think we've gotten all the questions answered. Just in reference to a couple of things I've seen out there, as I mentioned, we will be sharing these slides as a PDF in the post-event email that you will get from Kita. And that will have all this contact information. There will be a survey in there for you to complete. And if you need continuing education credit, you will need to complete that and in order to get your certificate. And
Robin?
Yes, yeah.
I would like to mention it that all our services are free. We don't charge anything, okay? It's free. We are a funded program. Like I say, we are funded by the federal, state, and county governments. So all our services are free.
Wonderful. That's really great to know. And I think that's important for everybody listening and for your clients and your patients to hear as well. As I also mentioned, we are recording this program, so it will be on our Charles E. Smith Life Communities YouTube channel. You can also find it on our website. We have a video section where we have recordings from this program as well as all of the other programs that we've done. If there are no other questions, we will conclude today. Rafael, thank you so much for all this information. I found it really interesting. I hope everyone else did as well. And once you get the slides, you can email Rafael at SHIP to ask any other questions that you have. Please check our website, smithlifecommunities.org, for other upcoming programs. We generally do a program or two a month, and these are free and open to the community. Thank you all so much for being a part of this, and we look forward to seeing you again soon. Be well. Take care. Happy New Year to those who celebrate. Bye.
Thank you, Robin. Bye-bye.
Thank you. Take care.